crosses the
Yolanda Coleman is 45 years old, a single mother. Her breast cancer has entered her bones. We found her at home, bedridden, with a broken hip. It's hard to know how much she could benefit from chemo, but when we met her, she was receiving almost no care at all.
A few months ago, there wouldn't have been any question about whether you could have your next round of chemotherapy. UMC would have been available and you could have gone there.
Yes.
What does it mean to you that that is gone now?
It's devastating, you know. It's absolutely devastating.
She worked her whole life as a maid in hotels and as a truck driver, which was better money to support her 9-year-old son and 16-year-old daughter in the next room.
As we sit here at this moment, you don't know.
I don't know
whether there will be another round of chemo for you.
I don't know. I don't know. It's just so uncertain right now. I really don't know. I'm just trying to live it day by day and trying to keep my spirits up and trying to keep, trying to get well so I can take care of them two I got in there. I got to take care of them.
She had 3 rounds of chemotherapy under her insurance plan. Then she became too sick to work and lost her insurance. Exactly the situation UMC used to take care of.
Yolanda, I think most people watching this interview think to themselves that if they get cancer and they don't have health insurance, that somebody's going to take care of them.
No, it's not. No, there's nobody going to take care of you.
Is what's happening to this hospital in Las Vegas unique, or is this kind of thing happening all about the country?
I think this is happening to some degree to probably every public hospital across the country. I think it's happening to us to a greater degree because we're sort of the epicenter of what's happening. We're a demonstration project, if you would, of all the things that can go wrong at once.
Nick Spiritos, the doctor we met closing the women's clinic, has not been able to leave his patients behind.
We've taken care of these ladies for years. They've been in our family. You're not going to push them out in hard times.
He took a storeroom in his private office and spent $100,000 turning it into a chemo clinic for ovarian and uterine cancers.
And you told them they could come here to your clinic and receive free medical care?
Correct. We've asked those who can pay. If they can pay $5 a month, they pay $5 a month. If they can pay $20 a month, we're asking them to do what they can, and those who can do nothing, that's our job to take care of.
Spiritos expects 10% of his patients won't be able to pay, so he and his partners will cover them. They put collection boxes out at convenience stores around town. Other private clinics are also providing free care, and charities, including the Susan G. Komen Foundation, are stretching to help the desperate. But these are emergency measures. After a month of uncertainty, Helen Sharp was treated at UMC. With the outpatient clinic closed, the hospital admitted her as an inpatient. It says it made an exception because her heart disease and diabetes are life-threatening complications. But Livia Ralphs is still searching for care.
I'm going to die if I don't get treated. That's the bottom line here.
Yolanda Coleman remains untreated, and after our visit, a medical supply company took away her bed and her wheelchair.
You never know what God has for you down the road, but I know He has more for me than just to leave my children because I can't have medical insurance.
Roy Scales has been calling the private doctors on that list University Medical Center sent with its letter. He's been searching for someone who will accept payment from the County Medical Assistance for the Poor, something he calls insurance. But it's been 5 months since he was diagnosed.
How many doctors and oncology practices did you call?
Oh, man, that'd be at least 25.
And they told you what?
Well, what about your insurance? I told them about the insurance. Well, we don't accept that insurance.
What are you going to do if you can't find a doctor to take care of you?
Die peacefully.
Roy is now in hospice after finally consulting with a doctor. Yolanda Coleman, the woman we saw in bed, had her insurance reinstated after we called the insurance company to ask why she'd been dropped. The Nevada state legislature is now considering a proposal to cut millions more from the budget of University Medical Center.